So we had somebody call into Instagram or message in about why doctors don't like to do liposuction in the inner and outer thighs, calves, and ankles. And it's not that we don't like to do it, but there are several different reasons, and part of it's patient expectations. A lot of times cellulite cannot be managed with liposuction. There are some modalities such as sulfina and possibly cellulase that usually only take you down about a notch. Now when it comes to the calves and ankles, there's many different factors that contribute to large calves and ankles. One of them is the muscles, and sometimes in some parts of the world, they actually shave down the muscles. Now in other parts, it can be due to lymphatics, and that means the lymph vessels don't drain the legs properly and you collect fluid in there. And really doing liposuction is not necessarily going to help that. Now, when you do liposuction, you have to be careful about a lot of the other structures, which are the nerves, arteries, and veins. And because of that, because it's the most dependent, or it's the lowest part of the body, it's super important to wear compression. And typically this takes a lot more compression than anywhere else on the body. So it takes about 3 or 4 months at least to wear compression, whereas in other areas we'll wear compression for about 6 weeks. So if you look at the anatomy, we have the gastrocnemius muscles right here. You have to be aware of that. There's the Achilles tendon. You definitely don't want to do liposuction over that. That's a very thin area that can cause a lot of problems. And then there's not many structures down here at the ankle, so we can do liposuction there. There are the arteries and veins you have to be aware of. There's also lymphatics that we mentioned about, but we're not really operating on the lymphatics. And then there's also the nerves. There's a very important nerve around the head of the fibula, up around the knee, that can cause a foot drop. And then there's other nerves that go down the leg that can cause pain if they're injured or there's a lot of scarring around there. Now, sometimes people are just not candidates for liposuction. So one thing that we've been doing, and it's an off-label indication, is we've been using Kybella for a few select cases. And it's not going to cause a dramatic difference, but in some patients, they're very happy. This is one patient just after 2 treatments. We've actually gone on to do 3 treatments, but she comes from St. Louis, which is about 6 or 7 hours away. And she's been very happy. And this is after 2 treatments. We've done 1 more treatment since then, and she continues to note improvements. She's actually got a 1-inch difference in the circumference around the ankle. So that is an option for some patients who don't want surgery. Hope that helps to answer your question.